Ram Khandula, Chief Information Officer with ADMH. I'm in central office, but the bits is spread out in central office and at Bryce. So we do have few folks working in here. We have around 32 to 40, in between 32 to 40 as a team. Basically, bits manages all the systems that relates to our facilities. We support all the infrastructure at every facility and regional offices, be it network, telephones, cell phones, and systems. So in general, people tend to think if you work in IT, they can handle everything, which is not the case. Everyone is specialized in their work, and that's the reason we have several teams spread across IT. Some handle server administration, help desk, infrastructure. So I manage all the teams in IT. I started with the state in 2007, and that's my first job with the state, and started with corrections as a contractor for 1 year, and then I became a merit employee. Been with corrections for 12 years, and then after 12 years I moved to SBS Finance, which happens to be in the same building with ADMH, right across Commissioner's office. That's when I got to know several folks from ADMH. When the position opened up, I had to call those folks to tell me how this department or how this ADMH works, and I got into, and I'm liking it. It's been over a year now. I'm with ADMH, and I'm liking it. Technology is evolving, and we need to keep up with the technology to keep our system secure and to stay with the latest infrastructure. Good. The difficult part is budget to keep our systems running. We need to. IT is not cheap, so we need to keep up with the technology. So you got to spend more, and again, you got to be reasonable on how you spend. I like the team that I work for, and I like the leadership that I'm working for too. So everyone has been supportive for last 1 year, and I'm liking my job.
My name is Ernie Devenisha, and I am an IT Manager 1, located in Central Office. I moved down to Prattville in 2016. Oh, I'm sorry, it was 2015. 2015, and just I got a job as a contractor here at ADMH, and just really enjoyed the work and the people. I think the most challenging part is just kind of balancing, the workload when they're doing different roles. Whenever more than one has a demand that's high at the same time, it becomes a little challenging to be able to do all that work at the same time. And actually, working with the people, like the reason why I did stay on, is just everybody seems very good at what they're doing. They seem very dedicated. Uh,
My name is Betty Hurd, and my title is Programmer Analyst 4. Okay, Mona Horn and I work together, and we are the support team for uh, MI Medicaid, payroll, both state employee and residential, personnel, certification, and we're the backup for operations. About 34 and a half years. I really wanted to be an RN. That was my dream. But I had a math teacher. She was my 11th and 12th grade math teacher. And I loved math. And second, I loved science. So I came up with nursing. She suggested that I go into computer science. And since I admired her and I valued her opinion, that's what I majored in. And so I came to Alabama Criminal Justice Information Systems. I worked there close to 2 years. And then I got a promotion and I went to Alabama Department of Human Resources. Worked there about 2 years. And then I got another promotion and I came here to Alabama Department of Mental Health. Right now, I think our most challenging thing is we are mainframe analysts, so we are transitioning to the server environment. So it's the learning, managing your time for the learning, and as well as carrying out the job that you have to do daily. I think seeing the finished product, giving it to the different professionals in the different service areas where they can give better service to the community that we serve.
Hi, I'm Stephen Brown. I'm an IT Systems Specialist 3 in the Systems Administration Division here on the fourth floor and central office. So I'm a systems administrator, which means we handle the server administration, making sure everything stays patched and secured, along with deploying applications, creating images for new computers, and everything involved in that. Before I came to the Department of Mental Health, I've been here for a year and a half, a little bit, around about a year and a half. I was with the Alabama Real Estate Commission for 19 years. Started out with as an entry-level technician there, and through multiple different advancements, stayed there for 19 years. Before that, I worked for 2 years as a Department of Defense. So the most challenging part is keeping up with technology with limited financial and manpower resources that we have that I'm sure that every division deals with, trying to stay ahead of the curve and ahead of the bad guys when it really comes down to that. The most rewarding part, customer service is important to me, and that's the biggest thing. I worked all through high school, and even part time later. I worked retail. I worked at Radio Shack, but making sure that the customer, and whether that's our fellow state employees, whether that's the public, has what they need is important. I think that technology should make people's lives easier, and quite often it's the opposite. People are burdened by changes in technology. When I can make somebody's job, make their lives easier, especially on a personal level, one-on-one, that's very rewarding. That's what makes all the difference in the world.
My name is Albert Ike Jr., and I am an IT systems technician too. Office is located at Bryce Hospital in Tuscaloosa, Alabama. I currently work along with my teammates to manage and resolve efficiently a request that come in to us through the service desk. I moved back home to Alabama from North Carolina from working in IT in private industry to working IT in higher education. And a few months before my first child was born, I started working in IT at Bryce Hospital. And I have been here with the department for 22 years. Challenging part of working in the office are the volume of requests, the multiple platforms, the multiple sites, and the always constant change of technology. And also to take the little resources that we are given sometimes and make the best of them. The most rewarding part of working in the office is the family environment amongst my teammates, the opportunity to meet and interact with employees at different facilities, central office and the regional offices. And it's just amazing to see how all the pieces of the puzzle work within the department to make mental health successful. The rich history of mental health and how it came about, we work upstairs in the Tuscaloosa office next to the historian, and just to find out how some things have just transformed over the years, and that's just amazing to me, and the many advances that we've made since then.
My name is Blake Smitherman, and I'm an IT systems specialist too. I'm located at Bryce in Tuscaloosa. Projects concerning infrastructure, which could be setting up new offices, maintaining the data closets, Wi-Fi, telephones, intercoms. That's pretty much anything that's network related is what I work on now. My 16-year-old brother passed away 10 years ago, and he always believed that I could work in IT. And at the time, I was an ABC store manager, and I decided I wasn't living up to what my brother believed that I could be. So I got a IT certification, and then I went around looking for every entry-level IT job in the state. And then Cindy Schrum hired me, and I've been here ever since. Being expected to be in multiple places at one time. The opportunity to give back. I've suffered through mental health challenges in my life as a kid and as an adult. It's something, you kind of always got to work on. But I mean, for me, this job, I don't have the skill set to provide direct care to help people. So my skill set I can bring to the table is to help everybody be more proficient. So I feel like I'm giving back to people that are like myself that are going through mental health struggles. So if I can make our workers more efficient at the job that they do, then indirectly I get to help them as well. So that's what brings me happiness about this job, just the power to help people in our community. Even though I don't have the skill set to directly help, I can still make everybody else more proficient so they can help more people.